Yes, off you go, Senator Wright.
Yes, thank you, and good evening, and Mr Butt. In tasking the Commission with the review, did the Minister request the Commission or the Department to compile a list of inquiries into mental health and their recommendations that have previously occurred to avoid duplication?
The Minister didn't request it of us, but we have actually done that. Mm-hmm. So we've done an assessment of what recommendations have been made, what reviews have been done, what recommendations have been done. That's been part of our literature search. So yes, and good. I think that's been one of the issues, of course, that there are a lot of reports and recommendations that don't necessarily align.
So on that, can you tell us how many federally funded reviews and inquiries into mental health there have been in the last decade?
I would have to take that on notice, Senator.
Okay, thank you. Can you give us a bit of a ballpark figure?
No, I could not, sorry.
No, there's so many. Because there are a lot. I mean, I think everybody understands that this is a very, very reviewed and inquired into and recommended into area, isn't it?
Well, in many ways it's both reviews but also plans and roadmaps. So there's been a whole range. It depends what you call a review at the end of the day. So there's been reports on specific aspects. There's been broad reports. But there have been mental health plans. There's been roadmaps. There's been state level.
Senator, there's been an awful lot of analysis.
There has been Senate inquiries.
Awful lot of analysis.
I don't know about the emphasis on awful, but certainly a great deal.
Okay, let me rephrase that. That's a fair point,
that's
Senator.
right.
There has been a very large amount.
That's all right. I was only teasing. So if you could actually, that would be good to
but we are certainly taking those into
account.
Thank
you. Yeah. Okay. Can I ask the Minister, please? Given that consideration of various mental health programs and so on, as we've already heard today, of course, has been deferred in this budget pending the outcome of the review. How will the Commission's report from the review influence government funding of mental health into the future? I'm interested in knowing what the process will be once the report is received.
In terms of the exact detail, I'll take that on notice for you, Senator, but certainly the government's expectation is that we will be very well informed by what is obviously a very detailed review of the sector, which is necessary and appropriate. And I think there's a lot of work that's being done by the Commission that will be very valuable in terms of informing government's way forward.
Well, I'm asking about the funding. Is it possible that the government will receive the review and think, gosh, there's a lot of good work happening with these programs, and indeed there's been gaps identified where more funding would be a very good idea? Is that possible, or is it more likely that in fact the government will say, no, there won't be more funding available, there may be less funding available? Because that's what the public is really wanting to know.
Well, it's very much a hypothetical question, and I wouldn't like to preempt the work that the Commission's doing, and we'll be waiting for the report.
So you can't really say anything except that the government will look at the report when it comes out?
Well, that's right, and I think that would be the expectation. I don't think anybody would expect that the government would preempt the findings of that, or indeed make any indication as to what the view would be prior to actually receiving the report.
No, although it's not unfair to suggest that maybe given that there is a lot of people who would say that mental health funding generally is disproportionately underfunded compared to its burden of disease, that the government could be saying, well, look, we want to spend more, but we want to know how best to spend that money and what programs are apparently efficacious on the basis of the review report. But you're not willing to say that, I guess,
well,
from
look,
what I'm hearing.
There are various views for various reasons, and that's precisely why we've done the report, commissioned the report, is to be well informed.
Yeah, and is it possible then that there's also speculation, I'll start that again, there is also speculation that the government is actually emphasising efficiencies and duplication in order to actually justify making less funding available to mental health in the future?
Well, I really don't think it's appropriate to make any commentary until we let the Commission do its work. They're obviously doing that in a very thorough and very diligent manner, and we'll make commentary once we receive the report.
Okay, thank you. So will the 2015 budget detail mental health funding over the forward estimates, or will services be funded only year to year?
I certainly couldn't comment on next year's budget, Senator.
And can I come back to you, Mr Butt, please? What funding and staffing changes have occurred in the Commission over the past 12 months?
The funding, year-to-year budget, our budget this financial year, 6.4 million, departmental and administrative next year, 6.5 million, so it hasn't really changed much, as you would expect. We have a staffing allocation of 13 at the moment. My FTEs are 10 because a couple of people had left. I'd have to, to say numbers who have gone and come, I would have to go back and check.
Yeah.
So I'd have to take that on notice.
Sure.
But it's just normal coming and going. Deputy CEO Georgie Harmon went to take over as CEO of Beyond Blue, so that was a recent gap that occurred. We also are getting some assistance from the department, so I've got 2 people on secondment at the moment, and I'm also getting some support from using 5 people in the Business Services Centre of the department for the analysis of the large number of submissions that overwhelmed us somewhat, so that's been good. I haven't asked for additional funding or additional support above that.
And so those 2 additional people from the department and those 5 people in terms of managing the submissions and so on, are they part of the 13, the staffing of 13?
No, but, as I say, at the moment FTEs are 10, our head count would be, the 5 aren't permanently on this, so it's only a short-term type, so it's not a full-year effect, so the full-year effect is quite minor. So no, they're not part of that. But the decision by government was to give us the level of support that was required to get the job done, and my assessment at the moment is that what we need at the moment is that sort of staffing support from the department. But it's going to be, as I say, the BSC role there in relation to the analysis is short term. Other roles might be longer term.
Can I ask you, given the Commission of Audit's findings generally, is it anticipated that the Commission will continue to exist in its current form over the forward estimates?
Senator, that's a matter for government, not for the Commission.
I should have directed that to the Minister. Given the Commission of Audit's general findings, is it anticipated that the Commission will continue to exist in its current form over the forward estimates?
Well, Senator, I'll need to take that on notice for you.
Thank you. And can I ask you, Mr Butt, to what extent has the Commission considered the National Mental Health Services Planning Framework, which was completed in 2013 in its review of mental health services?
Senator, we don't have access to the National Mental Health Services Planning Framework. That sits with the Commonwealth and the states and territories.
Have you sought access to that?
Yes, we have, Senator.
And so can you explain why you don't have access to that?
I think that would be a matter question to the department.
All right, well perhaps I'll come back to that then, and to the department then, because my understanding is that the framework took 2 years to complete, originated in COAG and was coordinated by New South Wales Health and involved dozens of senior people from the sector. So it would seem to me very logical that that framework would be at least available for consideration in terms of the thorough review that the Commission is undertaking. So can I ask the department why the Commission wouldn't have had access to that National Mental Health Services Planning Framework? It would seem very logical material for them.
It was the National Services Planning Framework was a framework that was done through all jurisdictions, and all jurisdictions needed to agree and respond to do that, and that's not been the case.
So who hasn't agreed then, Mr Booth?
It has not come forward to the multilateral forum for endorsement because the technical work, my understanding is a number of jurisdictions had some issues with it, and it has not come forward for ministerial endorsement.
So is my information that it's completed wrong then? It's not actually completed, or
well,
it is completed?
It's not endorsed. Some of the people who worked on it might think it's completed, but frankly, until it's endorsed by all jurisdictions, it is not completed.
So who are the jurisdictions that haven't endorsed it at this stage?
I can't answer that question, Senator, I'm sorry.
When you say you can't, do you mean you don't have the information
available?
available? Can you take that on notice?
Absolutely.
Thank you very much for that. It just seems to me that if we're having a serious review on which presumably programs are going to rise or fall and funding will presumably be allocated into the future, that's certainly the picture that I'm hearing, it would seem really logical to take advantage of the huge amount of work that went into that as well.
Yeah, although Senator, I mean, I have some passing familiarity with this, and I would say that my observation of it from a distance was that it was drawn up by people in and of the sector without a broader grasp on broader approaches, which meant it was a little self-referencing.
And Senator, from the Commission's perspective, while it would be good to get access to it, there's not much point getting access to something that hasn't got broad support, because it would not have credibility. So there's not much point us pursuing that until the states and territories are comfortable that what they would be giving us.
I can
It's a
understand
good
that.
product,
I'm just imagining that there's a research basis to some of the framework that would be potentially useful as information for the Commission. But anyway, the question's been taken on notice for me. Thank you, Professor Helton. Thank you, Chair.